Hello and good morning. Thank you for joining us. I am Molly Reichard with the Northwest Industrial Resource Center. I believe most of you are familiar with us, but just in case you're not, we are a public-private partnership serving manufacturers in the 13 counties of Northwest and North Central Pennsylvania. Our mission is to drive impact for manufacturers by working with our clients to improve their competitiveness, enhance productivity, and accelerate technology. Everyone will be kept on mute during the duration of this webinar. We do still encourage you to ask questions as you have them. You may ask your questions using the chat box located in the lower center of your screen. Feel free to open that up and put any questions that you have as you have them, as I stated. Also, if you're having any technical difficulties, send a chat to me. You can find me as a panelist or a host, or you can send it out to everyone and I'll try and help you troubleshoot that. We'll address the questions at the end of the webinar. We'll also send a recording of this webinar out early next week. I'm happy to introduce our presenter for today, Todd Sturgeon. Todd is the founder of Sturgeon Consulting. He has an extensive background in safety and insurance, and he partners with clients to analyze the risks and exposures of their business and helps them implement a comprehensive plan. So with that, I will give you Todd.
Thanks, Molly. The webinar we're doing this morning is kind of a update of one we did about a month and a half ago. That includes a lot of the new components of the startup phases, some of the regulatory updates that have occurred. So we're going to try to flow through this in a manner that leaves us enough time at the end for any questions that would come up, and then we can field additional ones that get forwarded after the webinar occurs. So to kind of get started and run through this, the core concepts of things from the CDC are what we rely on, and many of those core things have not changed. You know, we're still looking at social distancing, we're still looking at cleaning, screening certain individuals. Masks have become kind of a common thing that we see throughout not only our state but other states. How the virus spreads, the main components have been the same, but there's been some confusing information that we'll kind of discuss. But when we look at where are most of the transmissions traced to, it is close contact within 6 feet. And it's when a person who's infected spreads respiratory droplets from cough, sneezing, or talking, and it impacts another individual. It can come from solid surface contact. That could be it remaining viable on different surfaces. I touch it and then bring my hands up to my eyes, nose, mouth, that mucous membrane impact. And there's even been some cases where it does transmit from a person and picked up by an animal, but those are very rare situations. I've gotten a lot of calls recently when there's been some changes in information or confusing information, and even the CDC itself has kind of had some moving targets, where originally it was a high threat of potential on surfaces and not just the person to person. And then there was a release that came out and said that it does not spread easily by touching surfaces. And then the CDC backpedaled the next day and said, oh, no, we still mean that surfaces are a risk, but person to person, when it's a cough, sneeze, talk, is still the most likely. So when you hear changing information and guidance, what do we follow? What is the best protocol? Pennsylvania did release some statistics recently where they came out and said, hey, where is our mortality impact? And the average age that was reported was 79 years. Most of the cases for deaths have been in nursing homes, and they even had data as far as for nursing home deaths, how many pre-existing serious conditions did that person have based on that mortality rate. So that is the high risk area of the population still becomes a valid thing we have to be aware of. One of the core components of protecting your organization, your employees, and maintaining operations is to have a pandemic management plan. And something that we've had in place for our clients for 13, 14 years or longer is an actual written program. And these were developed back when we've had previous different types of outbreaks, whether it was a SARS or an Ebola or something, because sometimes larger customers would mandate down to their vendors, hey, make sure you prove to me you've got a process in place so there's not a disruption to our supply chain. So in a pandemic program, we're going to identify key individuals who are going to step in and manage the process. How are we going to educate employees? What steps are we going to take to minimize the spread from person to person? How are we going to clean? What kind of schedule? Do we have enough supplies? We'll discuss some of the engineering and administrative controls later in the presentation. If we do have an event, how are we going to best respond to it? And then what is the long-term potential impact to the operations based on if we have a situation? Pennsylvania has promoted a phased reopening plan that's color-coded. Other states are kind of a numbered system, phase 1, 2, 3, 4. The red, yellow, green phase, kind of like a traffic light, is a little confusing because the green phase is not go like we normally think. It's more of a modified yellow. So the state started with a few key counties that were red, and as it spread and ended up the entire state at one point being red, that was the lockdown that we went through, and only life-sustaining or essential businesses or one that got a release were allowed to function and operate. The yellow phase, that's becoming widespread, and we'll look at a map of what the current status is on that. Still promoting that telework if possible. It lifts some of the aggressive stay-at-home orders. You bump up your gatherings to no more than 25. As we're looking to where a lot of our local counties go to starting tomorrow in the green phase, there has not been as much of a detailed information release as we'd like, as far as what does green really mean. And again, it's not a true green. It's more of a modified yellow. They're still looking at telework being strongly encouraged. If you were in one of the businesses that were in the 50% operating phase, you bump up to 75. The large recreational gatherings restriction is in place. Now, yesterday put out something that surprised me in that the large gathering restriction is up to 250 people. That's a lot of people in a gathering, and then there's no limit on a religious type of situation, whether it's a church or it's a church event. Restaurants and bars, you get into some of the services like barbershops, salons, those are able to come online. That's probably the biggest difference in the green phase, is those businesses that have been completely shut down now go to 50% capacity. The plans to go further than that are unknown. They're unpublished at this point, so we're not sure where that will end up. What the map looked like as of May 15th was the eastern part of the country locked in red outside of Beaver County and moved kind of western Pennsylvania to a yellow. The approach that will hit tomorrow, the southeast county block at Philadelphia and the surrounding counties and Lackawanna County and northeast PA stay red. A large portion of the state still remains yellow, but the northern tier has a large number of counties that do go green. They go into that modified yellow. They held a few counties out that were previously yellow, and there's some criteria from Carnegie Mellon that we'll look at of how these determinations are allegedly made. But again, yellow is what a lot of us have been under. There are still a lot of restrictions in place. The green, which the governor called the new normal, which we hope it's not because it's only a modified yellow, still has significant restrictions on businesses for operations. The timeline for reopening, the 17 county move that happens tomorrow is certainly a big part of that. By June 5th, the remaining red counties are supposed to move to yellow as well. For a timeline of additional counties going to green, nothing's been published, nothing's available. And the same way is, where's my next, what is my next phase beyond green? There's no information. So we continue to watch that. Now, they do mention that they use Carnegie Mellon's information for key indicators for reopening. So one of the first ones they published was looking at 50 confirmed cases per 100,000 residents over a 14-day period. That was kind of that main criteria. And as some of the evolving reopening phases have happened, then they said, oh, wait, there's more criteria. And as we keep adding these additional levels of ways to muddy the water of who gets picked and who doesn't, that can revolve around not only the number of cases per population, the commuting risk of people coming in from neighboring areas, what is the age demographics for the area, and some of those also is age versus number of intensive care beds available. So we have these continuing criteria that get added. And on top of that, in the information that was put on the governor's site yesterday, they also list additional criteria that they're going to potentially look at for opening up businesses, as far as supply chain components, unemployment potentials, social service benefits. Again, this continual muddying the water of who gets picked and who doesn't becomes challenging and frustrating for many businesses. So the opening phases still talk about how do we maintain a slow opening but not create more cases. It's one thing at the business level, but if you were out and drove around much over the recent holiday weekend, it's a total different thing when people get into their personal lives. And that's a hard thing to control and deal with. So ongoing things at my operations, how do I avoid an outbreak locally at my business? Continue the hand washing education and enforcement with employees. The mask requirement, as far as current data, is still required even if I go to green. What visitors am I letting into the operations? And we're kind of in a phase where people are getting fed up with having to do a lot of the extra protocols. And so this gets to a point where if people totally let their guard down, yeah, I could have a spike or a flare up at my localized business, which could impact that operations. So OSHA has been involved in the COVID process, not necessarily because they have a standard, because they are one of the enforcement wings when you look at incidents, injuries that they occur. And if I have a work-related case, I have to put it on my OSHA log just like another injury. So some of the guidance from OSHA is they use their little pictorial diagrams of, hey, are we thinking about social distancing? And we covered this in a lot of detail in the earlier webinar that's still available. But how can I rearrange a process from an engineering control basis of keeping people from being right on top of one another like we may have done on earlier assembly lines or process places? And that could be barriers, that could be moving workstations around. Those have been proven to be as effective as just about anything else. Limiting distance. And it can be a very streamlined, professional looking physical barrier, like a piece of plexiglass or Lexan is put up at an entry area, or it can be as simple and straightforward as a piece of cardboard that I tape up to separate a workstation of people being face to face from one another. Those work as a good barrier so that if someone does cough or they do sneeze and it's getting around a mask or they're not wearing a mask, it cuts down those droplets that could impact another person. If I have a situation at the business, what do I do next? One of those questions revolves around, if I have a person who's either positive or potentially positive from an exposure they have, how many other people at the organization could they impact? Now this is broken into a couple forms to get a couple different slides, but it's a single form where we do a contact tracing. And that contact tracing is, who is the individual? When were they first either positive diagnosed or suspected? When did symptoms first start? And then we're looking at a time frame of typically 48 hours before that. Who have they been around? What areas of the facility have they worked? Because that's where I need to concentrate not only my cleaning efforts, but also looking at other individuals that could be impacted. And I've had cases where the positive individual went and had lunch in their car with another employee. Now I've got 2 people impacted. Or I've had people come back to work and say, oh, my mother or my wife or someone else is positive and I've been in the same house and I forgot to tell you and I've been at work for 3 or 4 days. That creates a lot of confusion. It creates a lot of apprehension among the general employee population. So this contact tracing process is something we use localized at a business, but they've also got models that they're using from the state and throughout different regions. The cleaning protocols that have developed and have been enhanced throughout this entire pandemic situation is something that is a positive, I think, going forward. Because if I have developed better cleaning, disinfecting of commonly used areas, maybe in future cold and flu seasons, I have a lot less cases of people missing work. So that is an advantage. So when we look at cleaning, then the CDC has provided lots of guidance on cleaning, and cleaning guidance for healthcare, for agricultural situations have been around a long time with dealing with bacteria and viruses. And EPA has cleaners that are recognized as approved for emerging viral pathogens, but things like household bleach solution, 70% of our alcohol solutions are very effective, and they have published data on not only the effectiveness of different cleaners, but how many minutes until they're neutralizing things on a surface. So that is that increased information. They're looking at surface types. A solid surface, here's the best way to clean it. And the things that we've learned or businesses have had to adapt to is old cleaning methods may not be as effective. And I've seen cases where an employee will take one rag and wipe off 10 tables in a lunchroom, and the rag is partially saturated with cleaner, and maybe I just spread it from one table to the other. So now we have to make sure that we're certainly not putting the rag in contact with the spray nozzle. We use maybe one side of the rag to clean a table and flip it over and use the other side of the rag for another table, and then put that rag in the laundry bin, or it's a disposable, so that I don't have the chance of spreading from one surface to another. I don't spread it from one office area to another or one workstation to another. Those are critical things for cleaning surfaces. For soft surfaces, again, we've looked at how do I best handle it. I don't want to shake a rug, or I don't want to shake out garments or rags, because the potential of the dirt debris that's released from that could have surviving virus droplets on them that is transmitted throughout different areas. So it's washing, disinfecting, or I'm using a vacuum with a HEPA filter to clean carpeting ahead of time to minimize spreading things around. For employees who are using cleaners, who are cleaning areas, we have to look at their safety with the chemicals they're using. And I've had a number of cases where employees have not followed the mixing guidelines of a chemical, used it at a much higher dose, and ended up getting sick from that exposure. So it's proper procedures, hazard communication, looking at the safety data sheet, and then I'm using good protective gear, but inspecting it and make sure it's in good shape for what I'm using. And early on during the process, it was hard to get certain types of protective gear. I couldn't get maybe the type of respirator I wanted to fog or spray a chemical because it just wasn't available. Those are some of those challenges that when we look at for an overall pandemic program, do I have these available and ready as part of my supply methodology? Cleaning still has to be shown effective. And I've had some OSHA complaints that I've had to answer are because employees were saying that I'm exposed at work, the business isn't cleaning properly. So one of the things I've encouraged with our client group is let's have a schedule. Let's initial off on the schedule. And it's very difficult to say I don't clean properly when I've got a schedule that I follow and we have people signing off on that. And then again, this is broken into a couple different slides. But the core components of a schedule is that people are assigned to clean certain areas at certain times that they mark off on. The high touch areas, your restrooms, your door handles, faucet handles, certainly are going to get a more frequent cleaning schedule. But even down to the individual level, individually, hey, if this is your office, you need to clean the phone, you need to clean the keyboard, you need to clean the door handle yourself multiple times a shift. And usually if it's their office computer, their workstation terminal that controls on their machine, they're more likely to clean it thoroughly because they're the one that's impacted and at that particular area. So it's key individuals assigned for cleaning, but also can be down to the localized user so that we're all working together to make sure that we're doing the best we can in that cleaning protocol. And again, encouraging employees to participate, but also enforcement and some of the education that has to be there in place to go with the enforcement is reminding people, hey, we don't just get tired of this and quit washing our hands on a regular basis. If you don't feel good, don't come in. You know, and I've had a case where employees show up to work, they've been there an hour and say, hey, I've had a fever all night, and I think I still have a fever now. Why didn't you come in? Why did you come to work to start with? We expected you to call off and not come in here and expose people. And if my hand washing stations aren't locally available in the operations, am I setting up separate hand sanitizer stations so that we encourage that? It's enforced, but it's also easy to accomplish because of the availability. And again, we've talked about some of the social distancing things. From the regulatory side, OSHA doesn't have a standard, but there are standards that apply. Hazard communication, personal protective equipment, respiratory protection, bloodborne are all pieces that make up pandemic control programs. Workers' comp can come into this as well as far as, is this a compensable injury based on what had happened? So one of the things that OSHA did is they put out a guidance order in early April. That was updated and effective the beginning of this week, 2 days ago. They put revised criteria on, is this a recordable injury or not for a COVID case that would show up. So first it has to be a confirmed diagnosed case. Show me the confirmation, because I've had employees say, oh, I'm positive, just to get out of work, and then you find out later that they've never been tested, there's never been confirmation. And then it has to meet the other recordable criteria. And there are work-related components, and there's also specific recordable criteria of things like, you know, put off work, restrictions, you get into prescriptions, sutures, broken bones. There's a whole guideline of what is recordable to start with. But OSHA then came back and, as part of this updated order, saying it's not always easy to say, is it work related or not? Because most people are out in the community where it's also present. And who's to say they didn't pick it up when they were at a family event over the holiday weekend or when they were at the grocery store? So for their field inspectors, some of the guidance that was developed and released earlier this week is, hey, if the business has done a reasonable job in determining whether it's recordable or not, we shouldn't penalize them if we dig and dig and dig further and think maybe it is. So what is that reasonable investigation? So it's not that I should be doing a full-blown medical inquiry. I try to get what information I can. So from the employee, how do you think you contracted it? You know, and that's a private discussion. Tell me where you've been. You need to be honest with me. Prove to me that's work related almost. You know, if you've been out in the community, if you've been out and around, how do we know what happened at work? And you have to look at other work site and environmental situations. Now, it's difficult to say it's not work related if I'm in certain occupations or if there's a number of cases at the business. And I've had I had a situation where, like, one engineering group had a third of the people who work in the same kind of common area all contracted. Well, that's pretty easy to connect the dots and say probably was spread at work. The other criteria that they've given is, what is my specific role? You know, so what is the evidence that it's work related? That's some of that guidance that they're trying to provide us. Could it have been outside of work? It's highly likely in the community spread areas. And then the Department of Labor also, which was published and hasn't gone away from early on, they categorized jobs as either low risk or very high risk. And so a very high risk exposure are the medical personnel in treating known cases or highly likely cases. Certainly if I contracted and I'm an emergency room doctor that's just been around people coming in that's positive, or I'm in the wing of the healthcare facility where we're treating positive cases and I get it, it's likely that it's work related. A high risk exposure, the next tier down, maybe I'm an ambulance driver, I'm a mortuary worker that is dealing with cases that were positive. It's likely that's the case for work related. When I drop into more of my medium risk zone, maybe it's the worker at the airport that people are coming off of planes, or a retail cashier in a highly infected area. I'm in New York City, Philadelphia. That still puts me in the medium risk. Where most manufacturing businesses fall is I'm in the low risk sector. I don't deal with the general public. I'm not required to deal with anybody who's impacted. These are the ones that are highly likely they're community related unless we've got a very specific outbreak. Think of some of the meat packing places where 2/3 of the employees or something have spread it between themselves. That's more likely than if I'm in doing that day-to-day operation at a normal business. To factor back into some of our other controls to consider, as part of our pandemic program, administrative controls are the ones we manage with employees, encouraging them to stay home. I'm altering things like maybe my break or lunch schedule so I don't have large groups of people together at one time in the business. How can I manage that to minimize that direct contact and maintain that social distancing? And we're keeping that education in place. So things we look at as examples is if I've got programs in place and I come into the lunchroom, everybody's got all of their stuff packed into the same cooler, where have those containers been and potentially spreading from one to the other? When I'm looking at my cleaning schedules, I can't forget like the silverware dispenser in the vending area, has it been wiped and cleaned out? Or did we forget about that? You see cases where businesses have very strict protocols out on the production floors, but you come into the break room and everybody's sitting together next to each other during break, or they're bringing their dirty lunch boxes and sitting it on the table instead of putting it in their locker. You go to a smoke break and there's 20 people all clustered together. That's where some of these program fails have happened, not during the actual work times, but between breaks and lunches. Other common controls, water fountains being shut down and providing maybe a bottled water that's individually dispensed, having extra hand sanitizer stations because we don't have a potable water source close to this area of the facility. Reminders on keeping that social distancing. My engineering controls, and we went into a lot more detail in our first seminar, but things that have become very important in this is I don't want to spread viruses through areas of the building. So in HVAC systems, first off, how many room changes per hour are being made? But during that room changes per hour, I don't want viruses to pass through my filter and be spread back into other workstations. So I look at the MERV rating on filters and they should be in that higher efficiency range where they capture smaller things. But when they're capturing smaller dust particles and viruses, I also probably need to change those out more frequently. And the personnel who are changing them out, maybe we're wearing gloves so that we don't, pardon me, we don't contact a live virus that could be there in a filter. And the HVAC industry has even put out guidance for their professional personnel coming out to locations. Other engineering controls, we looked at some of those barrier examples, more localized exhaust if I'm in certain jobs that could potentially spread it around, like a lab setting or healthcare. Moving personnel, we looked at some of the diagrams and changing processes to increase that social distancing. And again, we've mentioned this a couple times, but it is important to keep people focused on washing your hands. Don't fall back into the handshaking routines yet. Coughing into an elbow or turning and getting away from other people so I don't project those droplets. The reminder signs in the restrooms about washing. What am I touching? How am I washing my hands? And there's been many examples of teaching people how to wash their hands properly, and the demos online where they have the drop of paint on an outside pair of gloves and watch a person wash their hands and they don't wash the back of their dominant thumbs, or they're doing a poor job cleaning their hands because it's a quick in and out. I've got to take that extra time at this point. when we get product deliveries, are we just bringing things in, or do I quarantine them for a short time to potentially minimize that surface contact? So those are those continued safe work practices that we can keep in place now, but also think about going into the future so that I can maybe control the normal cold and flu seasons and keep my absentee rate lowered. You know, the protective gear, is it the right type? I'm going to have to enhance it if now we're going to go in and clean a area where someone got a confirmed case. We will wait our 24 hours if possible, but when I go in and clean it, yeah, I should probably have some better protective gear on. Maybe I switch to an N95 mask for the person cleaning that potentially impacted office, or what type of cleaner have I switched to? You know, and in the cleaning and disinfecting realm, it's important to look at the safety data sheet and how I'm going to apply it. And I've had cases where people look at a material, if it's put in a bucket of solution and I wipe it with a rag, the health effects are greatly different than if I spray it or I atomize it in a fogger. I need to be aware of that. And you know, there's three main cleaning or disinfecting groups that people have been dealing with: your quaternary ammonium compounds, your chlorine dioxides, and your hydrogen peroxide solutions. All of those have proved very effective, but depending on how I utilize them, you know, like a quaternary ammonium compound can be a lot more hazardous if it's being atomized and I'm breathing it or come in contact with it. So it's important to look at what is that cleaning solution. Am I making the best choice to not only disinfect properly, but safely with my employees in the operations? You know, for visitors, vendors, is this a critical person that needs to come in? Doing a questionnaire of where you've been, where have you traveled to? The temperature readings are common if I have to have an outside group come in. The downside to the infrared or the no-touch scanners is there are wide ranges of inaccuracies in those devices. And the worst is the general industrial one that I may use for checking breakers and other hotspots. It could be 3 to 4 degrees normal variance. Well, if I'm looking at a slight difference of 1 or 2 degree temperature and I'm normally off 3 to 4 degrees on a device, it's not going to help me a lot. But even the medical ones, and I've used more than I care to count over the past 2 months and dealt with, we're getting large amounts of inaccurate readings, so that it's always reading low 3, 4, 5 degrees. So I'd have to have a very high fever for it to even pick up and register. But those are pieces of that program that I can use for evaluation. If I've got field crew personnel that are going to customer sites, or going and traveling to job sites, and that's been an ongoing thing that hasn't stopped throughout this process for a lot of businesses. When I send that field crew out, first off, there's got to be client communication of where they're going to, so that they're still open, what additional protocols. I need to have enhanced plans for disinfecting tools and equipment. When I'm sending people out, it's difficult to social distance when they've all rode in the same vehicle out to the job site. So those are some major adjustments that field crews have had to go on through in the past couple months. And then if I've got a field crew that is returning from a job, how do I quarantine those from the rest of my employees that say I have a manufacturing operation as well, so they don't spread it from one to another? And that's required quarantines of tools and equipment, and also keeping that field crew away from the general body of the employees. The same thing could be for delivery drivers for my own product going in and out. If I get a suspected case, it's something that has happened to a lot of businesses, and it's that fear of, I hate to have that news occur, but if it does, what are my next steps? You know, my next steps are certainly getting that person sent home immediately if they're still at the business when it's discovered, or if the symptoms show up when they're at the business. It is trying to get areas where they've been cleaned thoroughly and effectively, and who are the other potential close contacts. And they've continued to change the definitions of what is this close high-risk contact. It's stayed within 6 feet, but some of the timeframes have changed. And they've even given guidance that it can be anywhere from 10 minutes to 30 minutes or longer, depending on symptoms are present or not. Is other people been wearing face masks? You know, all of those are proximity factors. If I have an employee who tests positive from the management chain at the business, how do we deal with it? We've got to remember that we've got to maintain confidentiality for starters. We don't just walk out and say, hey, Bob's got the COVID and he could affect everybody. We've had an employee who has tested positive. It's not a name. For the employee themselves, even if they've got mild symptoms, they're going to be anxious, they're going to be nervous, scared. So some communication with them. Hey, we'll get through this, get you through your quarantine, we'll get you transitioned back to the work environment. But we also need to talk to you about who you've potentially been around. So then the contact tracing form comes into play. And I need you to sit down and really think about, while it's fresh in your mind, who have I been around for the 48 hours before my symptoms started to occur? And then I've got to contact that group of personnel and we start monitoring them. And there's some protocols of whether they're on that list of essential workers. Instead of doing the full 14-day quarantine, can we do the continued temperature reading and mask wearing during that time frame? When I talk to my employee group, and I've had to do this a number of times over the past couple months, we've had a potential case or we've had a confirmed case. Here's where we're at. Here's what we're doing. Again, you're trying to bring down that fear and apprehension level of a large group of people. And if a couple of them start to panic, it can spread quickly throughout the group of employees. So someone in our place has tested positive. Here is what we've done to sterilize. Here's what we've done to disinfect. Here's how we're going to continue to monitor. Certain ones of you have been contacted of being in potential close quarters, being in that close contact zone with that individual. Here are those extra steps that have been taken with those personnel. We will continue to clean. We will continue to social distance and monitor situations. When I'm dealing with that cleanup, can I let that 24 hours pass so that any suspended droplets are certainly become not as much as an exposure? Open outside doors and windows, and then am I cleaning effectively and thoroughly? And that is always a question, because some people certainly are going to clean to a different thoroughness level than another individual. And again, is it the right cleaner? We want to use the correct ones, and there are wide lists available now of what are these emerging viral pathogen approved ones, but bleach is still effective. If I'm mixing up that 1/3 a cup per gallon, and that's a little weaker than the bloodborne 10% solutions, but effective and shown to be effective. Or the 70% alcohol solution, and even a lot of equipment suppliers or manufacturers come out and said, hey, we'd rather use 70% alcohol on our touch screens and on our different components so that the bleach doesn't go in and corrode the contacts. And one of the common things that I've noticed over the past couple weeks is, as businesses have been cleaning with bleach solutions for a couple months, they are seeing corrosion in places they never dealt with. They're looking at things they're going to have to repaint because of that bleach water seeping in between little cracks and openings in the paint and causing rust underneath it and blistering it off. If you're not sure if your cleaner is on the EPA approved list for emerging viral pathogens, you can Google the Center for Biocide Chemistries or the American Chemistry Council. There's also a link from the CDC that will pull up that specific list of approved chemicals, and they update that on a regular basis. So a lot of times, places that thought there was a chemical shortage, when they looked at what they had in stock already, it was already on that list of approved materials, which helped. There's other ways to clean as well. I've had a number of clients buy foggers, and there's a company in Florida that I've probably sold 2 or 3 dozen foggers for, and never met the company, but they were selling it directly from their operations. And I've used some of the foggers, and it's amazing how efficient they are at disinfecting a large area. You still have to clean a soiled surface, but I've had like a 1,000 square foot lunchroom that to wipe down every tabletop, every chair, every countertop to disinfect it would take an hour and a half. You can fog it in 5 minutes. So they're extremely efficient at sterilizing the surface. You just have to watch that I'm using the right chemical, that it doesn't cause a health hazard because of it. Other options, the portable UV sanitizers. These are being promoted now as a way to go in and sanitize and clean a surface without having to put chemicals all over it. They're promoting them for schools and showing diagrams. I've got one vendor that's carrying them as a supply, and it's a potentially good option. And the UV scanner information shows here's all our testing, here's all the virus types, here's all the bacteria types that it kills. They're putting safeguards in the scanner so that if I would turn it, it would get up towards my face. I'm not exposed to eyes and skin from using that device. So if you look at a lot of the UV scanner suppliers, they're sold out now because it's becoming this next wave of things that I'm utilizing as part of my disinfecting process. If I have an employee who's positive, if they're highly suspected of being in contact, when do they come back to work? That's been a common question. The CDC has not changed a lot of their guidance on this. You know, the original guidance that's been in place was 14 days. They did make some updates to individuals, especially in critical infrastructure jobs, but it's 2 tests, negative 24 hours apart is a common one. And I'm post so many days symptom free. And typically that's a 7-day past symptoms. Or if I've had a fever, I'm at least 72 hours past having a fever, and any other symptoms I've had have improved. And even beyond that, I'm taking additional days. I'm wearing face covering and extra protection in case there's not a recurrence, to make sure that I've passed that zone. And for the critical infrastructure jobs, instead of having a multiple day away, if I've remained asymptomatic, then we go into a protocol of checking temperatures and letting those people remain coming to work. You know, they get pre-screened at the door. As long as they don't have symptoms, they continue working as long as they're following wearing a mask and social distancing, so that we don't cripple those critical infrastructure jobs. We get a wide range of questions. The governor sites and the CDC sites have questions and answers that cover a wide range of topics. And sometimes the Q&A format give me some of the more details I'm looking at. You know, some of the common ones that the CDC puts out that they get fielded is, okay, I get a person that says they have a positive case. What do I have to do? You know, if it's beyond 7 days since they were at the facility, they say I don't have to do anything more than my normal cleaning routine. But if it's within that, then certainly I have to step up and follow those additional protocols. You know, do I need to shut the entire facility down to clean? And the answer is no. If it's in a specific office or area, I can clean that area only, and the rest of the business can maintain functioning if it's isolated at that point. Now, if the person has worked in the entire business and building, that becomes a lot more challenging and difficult. You know, can I remove a face covering? And this gets into a slippery slope, but you know, the information out there is certainly if they have a medical condition, if it creates an unsafe condition for operating equipment, I don't have to wear a mask. Well, then you get into the apprehension caused from different employees, and I've had businesses been reported and have to answer Department of Labor questionnaires because a person's not wearing a mask. A face shield has been approved as a viable alternative to the face mask. So in many cases, so businesses don't have the upheaval of one person wearing it. Employees who come forward and say, hey, I've got a medical condition or other issue where I can't wear an actual face mask, they issue a face shield, and then you can keep working. And there's alternatives to face shields. If the commercially purchased ones aren't available, you know, I had customers buying ball caps and using zip ties to put plastic film over the bill of the ball cap to get through that face shield covering during early parts of the situation, the pandemic exposures. You know, if you've got an elevated temperature, is that enough to send the person home? Absolutely. That is part of that, one of those criteria. If I get above that 100.4, you know, where do I take temperature readings? Ideally, it's as people are right before they're coming into the building. And back when the temperatures were cooler, this was more challenging because you definitely got more very low readings as the person was coming in from that cold environment. As we get into these warmer days, that's become less of an issue. So those are some of the key things that we kind of wanted to do in this update seminar, is talk about where have we changed, where we evolved to, what is the differences of some of these color-coded situations, but to maintain that core practice of cleaning, social distancing, looking at engineering and administrative controls to make sure that our businesses remain viable throughout this process. At this point, I think we're going to open it up to a couple of questions. If you just give me a second to get transitioned over. So one question that we got posed is, does the 250 people allowed for large recreational gatherings include a indoor wedding with buffet food? Good question. The guidelines that got published yesterday, and I encourage you to pull up you search the PA governor, if you Google PA Governor Green phase, the updates yesterday were very specific details, primarily on food service, on situations. And so one of the things that was specifically outlined as not permitted is any type of buffet food, any self-serving of drinks, food in any manner. The outdoor wedding, I think, would be a viable thing as if it's under 250, but you certainly have to look at how are we serving guests. And they even gave guidelines on, at like a restaurant that's opening for indoor service, you can't have ketchup and mustard on the table. It has to be the server come over and apply it for you. So they're going to some very strange detail as long in that arena on how does the general public evolve through this. Another question that came up is that it says face shields are an acceptable alternative. Where can we find that formal revision to the previously published guidelines? If you go to the question and answer format that's on the Department of Health and the PA Governor's website, the face shield alternative has been published it's been out and publicly available for more than a month now. And in that question and answer, it says, can I wear a face shield as an alternative? And it's spelled out on that governor page saying, yes, that's acceptable. And again, as we're getting close to the end of this, if there's questions that come up after the webinar, Molly can forward those to me and I can answer them by email as well. But we appreciate you logging on today. And again, we appreciate the continued support through ourselves and the NWIRC.
All right, thank you, Todd, so much for all that information. I think there's a lot of great information that everyone can take back and hopefully feel a little more comfortable with everything that's going on. Before we wrap up, I do have one thing I'd like to ask everyone to do for me, please, is I am going to set up a series of questions that you should see on your screen. If you wouldn't mind taking just a minute, it's only a handful of questions. Please answer these so that we can serve you better. You'll help us understand if we did a good job today, and also provide feedback on other trainings that you'd like to see us do in the future. So please go ahead and do that. If you do have questions in the meantime, feel free to continue to use either the chat box or the Q&A box. If there are any further questions, we will go back to those and answer those. So I'll give everyone just a minute to go ahead and enter that information, which we do appreciate your participation on that. And while you guys are finishing that up, I'd like to just thank Todd again for his time today and all of this information. If you do have questions, you can reach out directly to Todd. His information is up on the screen. Once you close that survey box, when you're done with that, you can reach out to him or you can reach out to us at the NWIRC. I'd also like to invite you to check out our future webinars at our website, nwirc.org. As I said, to see other trainings that we have going on, and we'll take your feedback from this training survey and hopefully be able to put together some additional trainings with the topics that you're looking for. So I want to thank everyone for your participation today. I don't see any additional questions coming in. We'll hang on the line for a few minutes to see if anything comes in, and we'll be able to answer that. But thank you everyone for your participation today, and I hope to see you soon, and have a great day. Thank you.